Chuck, are you going to announce the timing plans? Yeah, great.
Yeah, already talked about it a little bit even before you got on here, and I'll do that again here at the start of this.
Thanks.
And I am seeing we are at 1:15 and we're on Facebook, so we will go ahead and get started. Welcome again, everybody, to our weekly briefing on all things COVID-19 in Monroe County, involving the Monroe County, the city of Bloomington, Indiana University, and Indiana University Health. I am Chuck Carney, Director of Media Relations for Indiana University. And one thing of housekeeping before we get started, some of you heard before we got started here as well, we will have a news conference over the holiday break over the next 2 weeks. We will be back on the 30th, Wednesday the 30th at 2:45. So we will have one briefing during that holiday break, not next week, but on the 30th, and we'll all be here then. So to start us off with comments today, let's go to Bloomington Mayor John Hamilton.
Thanks so much, and thanks again for everybody being here. I'll mention, I've talked about the CBU, the utility study, that actually has finally been released publicly. So I just wanted to let people know that. There was a 13-week study done. It involved about a dozen communities. We were one of those most active. The actual data and full report are available on Be Clear through the city website if you'd like to do that. But so please take a look at that data if you'd like. The basic results I wanted to share showed that sampling of wastewater in the sewers actually provided results, data and results quite consistent with the case numbers that were found by testing, by individual testing in the communities that were studied. CBU will plan to continue sampling past this. In other words, it kind of confirmed that these data do seem to line up. The testing of individuals with the PCR tests and looking at incidents, as well as the sewer testing, which is done, of course, at an aggregate level. CBU plans to continue sampling on a regular basis and may be sampling at individual locations besides the water plants, the sewage plants, depending upon funding, depending on whether the state continues the funding past next week. Just noting that the study itself noted this can be helpful going forward, looking for hotspots that may arise or outbreaks. Even as vaccinations are spread, it may be a way to look for where outbreaks may be happening, even without the individual testing that, of course, is so important too. And it's really just another data point to share. But that is now available, and wanted to let people know that. We have continued spread. I know you'll hear more about that from health department and others, the hospital. We continue to see tough results while our rating as a county went down better, improved from 2.5 to 2. We still know we face real issues. Just as a reminder, we had about 4.5 months where we averaged 0 deaths per day on a 7-day running average in this community, in this county, for 4.5 months. And then we had a couple weeks recently in mid-November that kicked up to averaging 1 death per day in our county from COVID. And it is now, over the last week plus, 2 deaths per day in our county from COVID. That is a basic fundamental reminder of the fact that we still have very serious community spread, and despite heroic efforts, we are losing friends and neighbors to this disease. With the holidays coming, I guess I just need to encourage everyone to remember when you share air with somebody, you're really at risk of spreading or catching this disease, which can kill and hurt us dramatically. I will just say personally, Christmas is one of our favorite holidays in my family, and we love getting together. It is one of the highlights of the year. This year, it feels especially important to get together. My wife lost her mother while my wife was in the hospital from COVID. Her mother died from COVID. Another brother of hers was in the hospital at the same time. We desperately would like to get together, but we are not. We can't. It is not safe. So the regular Christmas gatherings in our family can't happen. I have a son who's in Georgia who we would always desperately want to see at Christmas, and we can't do it this year in person because we just have to take different steps. It's exciting. I know we're going to learn and maybe see pictures of the first vaccine locally, which is wonderful that it has arrived and will begin to move us toward where we want to be. But the next several months are going to be difficult. We are going to lose friends and neighbors. And in this holiday season, please avoid sharing air with people who are not in your immediate household now. That is what it's going to take to help avoid more death and challenges as we let the vaccines be distributed and shared. So I'm bummed. I wish Christmas could be different, but we just need to do the right thing this year. And I encourage you all to do so. Thank you for all you've been doing. It's been a excruciating year. We'll get to the end of it, but I wanted to let people know that and encourage you all to take care of yourselves, your family, and your community. Thanks.
All right, thank you, Mr. Mayor. Let's next go to Monroe County, to Penny Caudle, and get a look at what's going on with the health department.
Sure, thank you, and thanks, Mayor, for kind of that introduction into the not so good news. As you said, we are faring better than we were a little bit, but we're not doing well in terms of what we could do to curb the amount of spread in the community. And so we do encourage people to continue to stay the course with vaccine coming. That is a good thing, but it's not a time to let down our guard. Along with holiday, I would just say reduce travel, reduce gatherings, and that includes time you spend with individuals. Increase your distancing and your mask wearing. And if you are ill, stay home and away from others during this time so that we don't increase cases in the coming weeks. Testing is here. The Morton Street community site continues to be open to take people coming in for testing. We're accepting walk-ins, and we have a new lab, and that is proving to have a faster turnaround time for those results. So right now we are at the kind of 2 to 3 day mark, and that is improved. The lab actually is getting those and processing them pretty quickly, and then they just have to get them out to the system so that people can access the results. So we are pleased that that turnaround time is improving. We would encourage you to use the testing site on Morton Street if you need that. It will be open. Here's the holiday hours. It will be open 8 to 1 on Christmas Eve and New Year's Eve, and it will be closed on Christmas Day and New Year's Day. The regular hours are Monday and Wednesday, 8 to 3, Tuesday and Friday, 10 to 7, and Saturdays are 9 to 2. So again, encourage you to use that service if you need it, as well as the Optum site. I would remind people that they can get testing and vaccine information. We will be posting vaccine information as things unfold. I know people will want to stay abreast on what's going on with that. Monroe.in.us/COVID-19 will take you to the COVID page where you can select the type of information that you need. And with that, Chuck, if you would show that flyer as we start thinking about community vaccinations, and certainly there's a whole rollout with vaccine about hitting our most vulnerable populations and high-risk populations first with vaccinations. But as we start doing our public clinics, whether they are for a shelter or whether they are large-scale public vaccination clinics, we will need volunteers to help us. So especially with our drive-through clinics and those large clinics that we expect to do later this spring. If you contact the Medical Reserve Corps, it's not all medical people. And so if you want to volunteer and be a part of this, we encourage you to contact us. You can do that through Monroe MRC at co.monroe.in.us, and we will get you more information. It is important to get signed up and get prepared now so that when we need you, you are ready to go. And we've had people coming now wanting to volunteer, and we ask for more to come to do that. So I know that the hospital is our first line for vaccines, and I'm going to let them address what's going on with the vaccine right now. The last thing that I would say is that we are expanding our use of our compliance officers. That program is going very, very well. They've been very helpful to our staff and are expanding some of their hours to be more daytime hours, and they will be visiting other businesses, not just our retail food and bars. Thanks, Chuck.
All right, now we'll be working with Adobe to verify my subscription as soon as I can. Let's next go to Brian Shockney. We have had some important developments today.
It's been a good morning. First of all, I want to just review our data here where we are. First of all, we've reached a new peak in the South Central region for admissions over the past week. And then if you look at the data for our county, it's the same, and this would be including Monroe Hospital as well. We still are confident and able to serve our patients and our communities as we've expanded our bed capacity. Today, our ICU beds are at 75% occupancy in the South Central region, and we see that statewide they're at 80%. So we still have people who are very sick, and I appreciate the mayor's comments regarding it's not time to give up. You know, I'm a runner. I've said this several times that you know, when you know the distance you're going to run and there's a finish line, you know there's a finish, and we've not been able to see a finish line for a long time. And we don't want to stumble over the finish line. And stumbling over the finish line here would be stop wearing your mask, breathing other people's air that is not in your household, and not doing the things that are safe. And we also are not celebrating our Christmas this year as we have in the past, and that's the right thing to do. So as we go into the vaccine, we did get our vaccine delivered to our Bloomington and Paoli teams, and they started vaccinating this morning. We're very excited about what this means for us. We're also happy to say that we were able to vaccinate 15 of our frontline healthcare heroes this morning. This is our very first, and it's one of our nurses that is shared between the county health department and IU Health, giving that first vaccine to one of our healthcare workers who actually works in our clinic that cares for all of our COVID patients. This was a practice run for us today, and then starting Monday, we will be vaccinating up to 350 people per day in our clinic, or in our Bloomington site, and up over 150 per day at our Paoli site. Again, we presently are only vaccinating frontline workers who care for patients and have most contact with patients. That's our most important to get vaccinated right now. And as the vaccines become more available and we move forward, as we heard this week, the panel did approve for the Moderna vaccine to go forward. Our expectation is that at any moment, today, Friday, that the FDA will issue an approval. It could be happening as we speak. And that vaccine would hopefully ship this weekend to different states and different sites, and we can open up more sites and start vaccinating people at a faster rate. So keep your eyes and ears open on the media. Today is the magic day for Moderna, hopefully. And as you know, that vaccine is manufactured. One of the places it's being manufactured is right here in Bloomington, Indiana. IU Health physicians, this is a very safe vaccine. Over 93% of our IU Health physicians have said they would be vaccinated and will get vaccinated. So I just want to say, trust your doc, get the shot. You know, we have to, they're the ones who are the scientists. They've been doing this their whole life. And if 93% of them immediately said, I'm stepping up to do it, we know it's the right thing to do. So please make sure that you are, when you have availability to get your vaccine, you do so that we can move forward as communities. And as the mayor said, next year we can be in a very different place for our celebrations of our holiday celebrations and family celebrations. In closing, I just hope you continue to stay diligent, but take time to rest and focus over these next 2 weeks during this holiday time. It is a time of hope and joy and peace and we just want to be sure that we're taking care of ourselves as well as each other. And so we just hope and help you to have a happy holidays this time, and just keep your eyes focused on that finish line. We, this morning, seeing those 15 individuals frontline workers being vaccinated was quite an emotional event. We got to see the beginning of the end, and it was incredible. So thank you for all you're doing. Thank you to all that continue to join us here on this call, and we'll answer questions.
Okay, let's next go to the Monroe County Board of Commissioners, and today speaking for the commissioners is Penny Givens.
Thanks, Chuck. As everybody knows, we've been working hard to maintain both the economic and physical health of people in Monroe County. We are still accepting applications from Monroe County businesses and social service agencies to assist with COVID relief. The Monroe County CARES money is available to assist with COVID-related expenses that are not personnel-related and which are not covered by other funding sources. We lifted the cap up to $30,000 per entity, and as of yesterday, we had approved over $365,000 in funding and have completed, gone through all the application process for over 90 groups here in the county. Additionally, we have forwarded over $85,000 for our local taxing units. That's 6 different ones of those. If people are interested in applying for that money or in additional money that'll move them up to that $30,000 cap, please do that at our homepage, which is co.monroe.in.us. On Wednesday of this week, the commissioners also approved additional CARES funding for the Hoosier Hills Food Bank and Mother Hubbard's Cupboard, and that totaled $15,500. And we'd like to encourage residents to consider an end-of-year donation to the food pantry or to Hoosier Hills Food Bank, or even some other social service agency if they're able to do so. As I've said before, I think keeping people fed helps to maintain their immunity, which again helps to stop some of the spread of COVID. So we're working hard to do that. And finally, I want to urge residents to contact their trustee's office if they're facing eviction, problems with their mortgage payment or utility disconnection. Remember, every resident of Monroe County, including people who live within the city of Ellettsville or Bloomington, have a township trustee. We have worked with those trustees to provide up to a total of $100,000 for assistance, and we are preparing to share more in 2021. Finally, also, our county offices are open only by appointment, and that will probably continue through at least the end of January at this point. But again, this is an effort to keep both our community and our employees safe. Thank you.
Okay, let's next go to Monroe County Emergency Management Director, Allison Moore.
Thanks, Chuck. I'd like to start by just taking the time to thank all of the individuals that are on this call, every week. There's a lot of additional calls that many of the speakers that are on this call get together throughout the week to keep each other informed. And I know I'm very fortunate to be a part of that group. And we continue then to get to educate the community on this call. Every week we've been doing this since March, and then these calls shortly after that. And so we are a super blessed community that we have so many people that are caring for our residents. And so I want to thank my other colleagues on this call, and as well as our media for continuing week after week to release stories and let the public know what's going on to keep us all the most safe that we can. We do have 2 final blood drives scheduled in 2020, and there is one that still has a couple spots available. It's December 23rd, and you can register for the blood drive at the redcross.org website. We are the 3rd highest collected site in the state of Indiana so far for this 2020 year, and the 33rd highest collected blood site for in the entire U.S. So that is super great statistics. And so I want to thank all of those individuals that have been willing throughout this entire COVID pandemic for making those donations. We actually started scheduling those in March. We didn't have our first one until after that. So had we have started these early in the year in January, we could have potentially been the highest in the state of Indiana. And so we're excited to be a part of that and to save all the lives that we have by collecting that blood. So thank you to those individuals that have. You might have noticed on several different social media posts of our first responders that Santa is traveling around on fire stations. And so if that's something that you're trying to get scheduled for your little kiddos, but wanting to be safe through this pandemic, this holiday season, you can check out different fire departments' Facebook pages on social media and see if that route happens to be in your neighborhood. We encourage you, if it is, to step outside on your front porches with your family and give them a quick wave. And that just shows our first responders also how much we care for them. It has been very tiring for so many. As Brian Shockney said, this is a marathon that we're all in, and our first responders are also tired, and getting that encouragement from members and waving and seeing the joys from those families is a very high encouragement for them as well. And then lastly, I just want you as the public to know that our office is continuing to work with our health department, the Department of Homeland Security, and the State Department of Health as these vaccines continue to come out, and we continue to get plans and procedures in place for how we will vaccinate our public. I know at this time we don't have a lot of things released yet on how that will happen, but I just want the public to know that rest assured there are so many calls and Zooms that are happening to make sure that we have the best plans and procedures in place so that as soon as we do receive that vaccination, we will be able to implement setting up points of distribution sites throughout our community, and more will be coming. And that's joyful in this joyful time. So Chuck, that's all I have. Thank you so much.
Okay, let's next go to Indiana University and Kirk White, where the campus is cleared out, but the work is still continuing.
It sure is, Chuck, and thanks again to everybody that's participating. I'll add my sincere thanks for this great collaboration among all the people on this call, and the help we've had from our members of the media that have helped us get the communications out, that has really kept the community as informed as they can be. We've got to keep that going. We've got a couple of difficult months coming up, I'm afraid, but right now things are in pretty good shape, at least at the campus level. Across the board, last week's mitigation testing in almost all of our categories, the asymptomatic testing decreased in almost all of our categories. And that was with testing 8,200 people last week. So this week we've continued mitigation testing with heavy emphasis on our faculty and staff because most of the students are gone. And that will conclude tomorrow. Today, excuse me. Today is the last day of mitigation testing for the next 2 weeks. So then we will restart on the 3rd of January with the asymptomatic mitigation testing. And faculty, staff, and students who are here will again start getting emails to report for their regular tests. And at that time, we will start to have some re-arrival testing begin by some groups, small groups of students who will start filtering back to Bloomington after the first of the year. That early re-arrival testing will run from the 3rd of January up to the 30th of January. And then move-in week is that week of the 30th, when that begins on up to February 8th, when we switch to the partial in-person classes that will resume on February 8th. Now, it's of course important to note that the semester actually begins 3 weeks before that, but it's at a distance. And so our students, wherever they may be, will be logging on early to get their classwork done before then. Yes, the planning is going on, certainly for re-arrival testing for COVID to continue our mitigation testing trends. We're doing a lot of fine tuning. I think we'll have even better results and even safer opportunities as we come back in the spring. But I think also very important is that the mitigation testing and the flu vaccinations that we've done have prepared us well for the fact that the vaccines are on the way. And we're getting indications from the state health department that we will have some responsibility for our own university community members that are identified in those phases, phase 1A, 1B, and then phase 2 and on, for some of the immunization clinics for our own populations. So we're planning robustly now to have those ready for after the first of the year when those opportunities may present themselves for the folks on the campuses that are first responders, patient-facing, or others that are in the state-approved categories that will be communicated to us. So then finally, we've had a lot of challenges the past few months, really since last winter. And one thing we can celebrate is that the academic mission, our service mission, our research mission has continued through all this. And tomorrow we will see one of those milestones in that we will have a winter commencement. And it will be virtual, all virtual, no in-person commencement, of course, but this is a time to celebrate those who finished their degrees this semester and those who finished them last May, because we had to cancel commencement last May, but we've invited those who did graduate in May and completed their work in May or August or now in December to participate in tomorrow's virtual commencement. And we send our congratulations to those thousands of students at the Bloomington campus who will be participating, and send them all our best in a world that certainly needs their expertise. So thank you very much.
All right, thank you very much, Kirk. And we will turn to questions. First of all, from Dave Askins at the B Square Beacon for Brian Shockney, a question about the 93% of doctors who said they would get the COVID vaccine. Do we have any insight into why 7% of the doctors would not get the vaccine? That seems kind of high, he notes. Or is that about par for the course with the attitude of doctors towards vaccines generally?
I don't know the answer to the second question. The first question, though, that is very high. The polls and surveys we're doing in the public is around 50 to 60% of the public is saying they will get vaccinated. In that number of all the physicians who were surveyed, 3% were neutral. So that 93% is, yes, I'm getting it. 3% were neutral and 3% were probably unlikely. We also have to remember that some of our physicians that were surveyed have had COVID. And the indication is if you've had COVID, you have to wait. They recommend you wait 90 days before you get in line to get the vaccine. So that's part of that number. And then a very small percentage, it's contraindicated because of health reasons, or they may be immunocompromised and some of those things as well. So really that 93% is a very high number when you factor in all those other things.
Okay. Question from Jack on Facebook. And Kirk, you spoke to part of this already. Will IU still conduct random testing over the holidays? The answer is no. We're going to hold off on that. So if you want to add anything to that, you can. But I think this mainly goes to Penny. If they don't, will the health department adjust the positive rate when we no longer have 1,500 daily tests to calculate the positive rate?
Well, one, the health department doesn't change the positivity rate. It is based on the data, and certainly when we have fewer tests, it will affect our positivity rate. So it is quite possible that we could see our positivity rate go up because we may be testing. The positives may all be from that pool. When IU has a lot of testing, for example, or any place, and the numbers are very low, then you get kind of that balance. So it's possible that our positivity rate will go up a little bit. It's possible that it won't, based on just who's getting tested and who's infected and what community spread is going on.
This is a question for county officials from Jenny Tilley at the HT. With the recent rise in COVID-19 deaths, what has the impact been on the coroner's office? Penny, go ahead.
I wasn't sure which Penny was going to go first, and certainly I can't speak for the coroner's office. I know that they have been extremely busy, and that's always unfortunate when they are very busy. Do keep in mind that the coroner is involved mostly when there isn't an attending physician to sign off on that death certificate. I know, we've seen an increase, I think, in overdose deaths, and so the coroner's often involved in those. That would be a good question for the coroner, that she could really address that better than I can.
I will add, though, that we do have mass fatality plans in place. We collaborate with our coroner's office as well as Monroe Hospital and IU Health Bloomington. And each the county and of course both hospitals have plans and procedures put in place on what will follow when we do have certain limits that we hit. And we have not had to implement that at the county level, but we do have meetings, just throughout this entire process of the pandemic, just to remind our coroner and our deputy coroners of those plans and procedures and how we would have to follow those if such numbers would rise.
And Penny Givens, do you want to add anything to that?
Well, as Penny Cottle said, yes, we have a lot more unattended kinds of deaths, but as of early November, there had been 40 overdose deaths in Monroe County. In all of 2019, there have been 26. So we've seen a dramatic rise in overdose deaths. So if you know people that are hurting, please reach out.
Grim statistics indeed. I'm waiting for other questions. If you have some, we have plenty of time here while we're waiting here. A reminder that, again, we will not have a news conference next week. We will join you again at 2:45 on December 30th, a week from this coming Wednesday. And just another note, I don't think there's any reason to believe we're going to stop doing this in the new year anytime soon. I think that it's fair to say, and I'm seeing nodding heads, that we will be doing this for some time to come, and I think it's been valuable to get the information out, and we again appreciate the media coming to show up for this, because without you, the information doesn't go any further than this. So it's really very much appreciated. Again, happy to take any other questions if there are any. We do have some time here, but we'll wrap up otherwise if you don't, but I'll wait just a second here, resisting using the word vamp as I do every week. Penny, you want to add something?
I do. I will just add one thing, just a reminder that we do have naloxone available. With people staying more isolated and away from others, that can play into these overdose deaths. But we want people to be trained and to have naloxone available. So if you need that, you can reach out to the health department. You can reach out to Indiana Recovery Alliance. And there are some other entities that we partner with that naloxone is available through. So we would encourage anyone that may find that useful for them to reach out. We can still do that training and dispense the naloxone.
So here's another question from Dave Askins, the B Square Beacon. I think it's by now pretty well understood that the vaccine involves 2 doses, but often there are reports that X number of doses are being delivered someplace. Is there an easy way to tell if we should divide X by 2 to get the number of people? Because I think sometimes that arithmetic is done already in the announcement. Brian, I don't know if you want to take that on.
I think it depends on the announcement. It's best to count the number of people vaccinated rather than the vaccines that are arriving. The vaccine numbers and doses that are arriving at different locations in different quantities. In addition, for example, the Pfizer vaccine was scheduled to have 5 doses per vial, but actually you can get 6 doses per vial. And so that changed when we received the vaccine. So this is very fluid, but I would say we really need to focus on the number of people who are being vaccinated, because that's really what is going to get us out of this pandemic. If we don't get 70+% vaccinated, herd immunity, we will still be sitting here on the screen next December lamenting about Christmas. And so we don't want that. We want these, after the first of the year, we want these press conferences to be sharing positive news about declining positivity rates and people being able to group in larger gatherings and all those things. So I would focus our attention on the number of people vaccinated and really strive to get our friends, neighbors, coworkers, those people that we love to get vaccinated as soon as they can get scheduled to do so. And I'll turn any other comments over to Penny.
I was just going to say, and we haven't talked about this, but is there going to be a way, for example, each week to do kind of a chart that shows how many in Monroe County have been vaccinated? I heard it was 15 this morning. That would be our first little bar. By the next time we get together on the 30th, maybe we could share how many it's gone up from 15.
Actually, yes, we can. And after Monday, it'll be over 400. So
Good start.
Big jump in a week. And then the health department with Moderna coming on board, let Penny speak about that, but they'll be able to start vaccinating as well. So I think it'd be a great thing to share.
Brian, I think it's going to be great to finally have a chart that when the arch is going up, it's a good thing.
Penny, did you want to add anything on that?
Yeah, just briefly, we're making plans. We anticipate that by mid-January, we'll be starting to have vaccine and do clinics again. They will be focused on people who are still in those higher risk groups as things are tiered out. And while we'll be doing those vaccination clinics, we'll also be planning for the large public ones. And we will continue to share information on when that's available for you and how you will get it as it unfolds. But it is fluid and we don't have those answers today.
Yeah, and I'll just put my own personal plug in here. My brother is a medical doctor in another state, has already received his first dosage, and I'm hoping that my 92-year-old mother, also in another state, is right behind. So get the vaccine when it is available. Question from Facebook. Approximately how many out-of-county residents are in the hospital census for Bloomington? Brian, I'll turn that to you.
Yeah, I can't give you a total number. I can give you a percentage. We are still running at about 46% of our patients are Bloomington, Monroe County patients. The remainder of those COVID patients are from outside Monroe County.
Okay. I don't see another question this moment. I'll give it just a second here again and a remind once more, we'll be back on December 30th at 2:45 with our next news conference and hopefully some more good vaccine news to share at that time. Otherwise, we will go ahead and wrap it up here. Again, thanks for everybody for your attendance today and being here, and we will see you on December 30th at 2:45.
Stay safe
Happy
and
holidays.
healthy.
Be well.
Safe
Merry
holidays.
Christmas.
Thanks,
everybody.
See you again soon.